Washington. The former chairman of one of the House committees that drafted legislation to repeal and replace large parts of the Affordable Care Act came out against a new version of the bill on Tuesday, saying the measure now torpedoes protections for people with pre-existing medical conditions. Representative Fred Upton of Michigan, who chaired the House Energy and Commerce Committee as the Affordable Care Act repeal movement built steam, declared on a local radio show, "I cannot support the bill with this provision in it," just as House Speaker Paul D. Ryan was insisting that the legislation would protect the sick. The loss of Mr. Upton, an influential Republican voice on health care, was a huge blow. And it came as Republican leaders faced an onslaught of advocacy groups, political attack ads, and even a late-night talk show host, Jimmy Kimmel, saying the bill would harm the nation's most vulnerable citizens. Even former President Barack Obama piled on, tweeting. Mr. Upton was explicit. The concessions made to win over the hardline conservatives in the House Freedom Caucus were costing the leadership support from more moderate Republicans. "I'm not at all comfortable with removing that protection," Mr. Upton said of the pre-existing condition concession. President Trump, whose advisors have been pressing aggressively for a vote on the health care overhaul, seemed oblivious to the latest setback for the measure on Tuesday. "How's health care coming, folks? How's it doing minus all right?" Mr. Trump said, addressing Republican lawmakers attending a trophy award ceremony in the White House Rose Garden, the United States Air Force Academy's football team. "We're moving along. Think it's time now, right?" No response was audible from those in attendance, but the president addressed the rest of the crowd, adding, "They know it's time." Mr. Ryan insisted, "Republicans were making very good progress with our members," but he offered no indication of when a vote might be held on the measure. Trump administration officials have said a vote could come as early as Wednesday. But as House Republican leaders scrambled to assemble a majority, a quick vote appeared unlikely. There are a few layers of protections for pre-existing conditions in this bill, Mr. Ryan said at a news conference. "What's important is we want to have a situation where people can afford their health insurance. We want to have a situation where people have a choice of health insurers. That's not happening in Obamacare." Mr. Ryan and his fellow Republican leaders, under intense pressure from the White House, are struggling to round up the support for a revised version of their bill to repeal and replace President Barack Obama's signature domestic achievement. After the failure of their earlier repeal bill in March, they have held off moving forward with a vote while they try to build support. The updated measure. At the heart of the debate is an amendment to the repeal bill proposed by Representative Tom MacArthur, Republican of New Jersey, with the blessing of House Republican leaders. The amendment won over the hardline House Freedom Caucus last week, in part by giving state governments the ability to apply waivers from the existing laws required essential health benefits, such as maternity, mental health, and emergency care, and from rules that generally mandate the same rates for people of the same age, regardless of their medical conditions. The MacArthur Amendment has given pause to numerous moderate Republicans, in large part, of concerns over whether it would allow states to gut those consumer protections. As Mr. Ryan was defending the plan, The Association of American Medical Colleges came out against it, joining the American Medical Association and a host of disease advocacy groups. Drive. Daryl G. Kirk, the president and chief executive of the Medical Colleges Group, said the newest version of the repeal bill dilutes protections for many Americans and would leave individuals with pre-existing conditions facing higher premiums and reduced access to vital care. Under the amendment, states could obtain a waiver from a provision of the Affordable Care Act, prohibits insurers from charging higher rates to people with pre-existing conditions. With a waiver, states could permit insurers to charge higher premiums based on the health status of a person who had experienced a gap in coverage. To qualify for a waiver, a state would have to have an alternative mechanism such as a high-risk pool or a reinsurance program to provide or subsidize coverage for people with serious illnesses. States can't leave people with pre-existing conditions high and dry, Mr. MacArthur said Tuesday, defending his proposal. They must have a risk pool, which would protect people from being priced out of the market. Mr. Ryan is struggling to win the public relations battle over how his legislation would affect consumers. On his TV show Monday, Mr. Kimmel delivered a tearful opening monologue in which he revealed his newborn son had been found to have severe heart defect, and he went on to talk about the issue of pre-existing conditions. Whatever your party, whatever you believe, whoever you support, we need to make sure that the people who are supposed to represent us, the people who are meeting about this right now in Washington, understand that very clearly. Let's stop with the nonsense, Mr. Kimmel said. This isn't football. There are no teams. We are the team. It's the United States. Don't let their partisan squabbles divide us on something every decent person wants. We need to take care of each other. Both the Democratic Senatorial Campaign Committee and the Democratic Super PAC American Bridge are running attack ads to undermine Republican support.